Hi, in this video we'd like to continue on our series discussing Hyperemesis Gravidarum, where we break down each symptoms as to why they happen, and then the effective treatment, which is our HG vaccine that we offer here at the hospital to help you effectively overcome this dreaded disease. Now we're not going to be going into Hyperemesis Gravidarum, its description and what are its symptoms, how deadly it is. We've already covered that extensively in all of our videos. You can check out all our previous videos and also our articles, link in the bio. Today we'd like to talk about one of the 4 predominant symptoms that a lot of patients experience with HG. Now the 4 symptoms are, first of all, violent vomiting, violent nausea being the second one. Third one is excessive salivation or hypersalivation. And the last one is being insomnia or sleeplessness. Today we'll be talking about insomnia. Now this form of insomnia is actually different than your typical insomnia because it's actually caused by a primary disease. This is a secondary insomnia, and the primary cause is Hyperemesis Gravidarum. So this type of insomnia is actually quite peculiar, and it doesn't work with any typical insomnia medication. You can see that many of these patients, when they suffer insomnia, HG patients, they try to take all kinds of medications, pills to help them sleep, but it doesn't seem to work. It doesn't work for them, and they have to suffer this insomnia throughout the entire pregnancy period with no effective remedy, and it can really affect their mood, their health, and definitely affect the pregnancy as well. So we want to avoid all that unwanted consequences. So how does hyperemesis cause this insomnia in the first place? Now, we've explained that HG patients, they are very rare, and why it's so rare is because they carry these abnormal receptors that are hypersensitive to HCG, which is the pregnancy hormone. And we'd like to talk about where they are situated. So wherever these H2 receptors are found, then they will affect their respective glands, muscles, organs, cause them to be active, cause them to be constantly secreting, and also carry out their functions non-stop. So it's a hypersensitization reaction. They're constantly on alert, and the signals are constantly fired out. Now these receptors, abnormal receptors, are abundant, particularly in the brainstem. Now, the brainstem is the center where it regulates vomit, and it also regulates sleep and mood. So these receptors, they bind with HCG, and then they are constantly releasing these signals to its respective functions, carrying out all of these hypersensitization reactions, thus exhibiting these types of symptoms. So for sleep, the brainstem is actually responsible for a neural pathway that regulates sleep. It actually sends signals to the hypothalamus, and the hypothalamus, once it receives this signal, it will actually relay this information to the brain, telling it to actually relax, slow down, it's time to sleep, and then your body will go into rest. However, this pathway is affected because these binding reaction, abnormal receptor in HCG, is affecting this neural pathway, causing this person to be unable to go into any type of sleep. This neural pathway is affected, and they cannot get this deep REM sleep, this rapid eye movement sleep. So these patients, even if they can get sleep, it's not of high quality, and it's only very temporary. And this goes on for the entire pregnancy period. As long as this reaction is allowed to take place, this sleeplessness, this insomnia will carry on throughout the entire pregnancy period. Furthermore, this patient is now in a state of hyper sensitivity to her environment. So, for example, let's say she's especially sensitive to light, she's especially sensitive to smell, she's especially sensitive to taste, and also hearing. That's why some patients, when they get hyperemesis gravidarum during pregnancy, they cannot stand the smell of certain things that they used to love. For example, their partners, husbands, flowers that they used to love. Now they cannot stand it because the senses are being elevated. So the same thing happens during sleep. They are especially sensitive to the most minuscule form of light. The most slightest disturbances in light, the dimmest forms of light can actually trigger them to actually go into wakefulness. They cannot get the rest that they need. The slightest sound, slightest smell, all of these can actually, it's tenfold, 100-fold for these types of patients because they're especially sensitive, and because of these two factors, it's very difficult for them to get the sleep that they need, and eventually it will affect their health. It will lead them to actually develop high stress levels, higher anxiety, higher mood swings, very easy to get aggressive, easily irritable, and it can lead to depression. This depression can carry out the entire pregnancy, and they can develop suicidal thoughts if they do not get the proper management. So this is in fact a very severe symptom that needs immediate medical attention. Now, Antai Hospital only recommends treatment that works, because if you are a HG patient yourself, you've realized that even if you receive any type of management, you need to be dependent on them throughout the entire pregnancy period, and none of them are very effective. You still see the symptoms. That's why here at Antai Hospital we offer a proprietary HG vaccine. This is the only treatment that will actually work, and all of our patients who have received it, all of them can testify on how effective it is. Many of them have recovered immediately within a day or two. If it's very severe for you, then you will take slightly longer, but nonetheless, you will see effective recovery as long as you listen to our instructions and receive the treatment, which is very easily received as well. It's just an oral medication packed with intravenous injections, and it blocks the reaction from happening, the reaction that I mentioned, which is the binding reaction. And once that stops, the symptoms quickly dissipate, quickly go away, and you can return to normal life. You can begin to eat, sleep. None of the sleeplessness, the vomiting will persist anymore. So I hope you've learned something in this video, especially for our HG patients who are much more concerned about their health during their next pregnancy. Please get in touch with us, receive our HG vaccine, and see for yourself how you can actually completely prevent this condition if you receive it before pregnancy, and you can even effectively treat this, because this HG vaccine is the cure for Hyperemesis Gravidarum. So please get in touch with us, and also stay tuned to the next one.